A lot of horror stories of people going into the hospital, have one procedure done, and they come out with another procedure having been done. Or you go to the doctor, you put your faith in the medical professionals to put your best interest first. But mistakes do happen, and sometimes you are the one who are making mistakes. You're not totally honest with your doctor. You don't tell him what medications you're on, and he prescribes something, and he or she ultimately finds out that you have a bad reaction because you weren't honest. All these things can and do happen. Well, Dr. Assil Saleh is here now from Foxhall Internists, and she has a couple of things that you definitely need to remember before you leave the waiting room. Doctor, thank you very much for coming in.
Thank you so much for having me.
This is a very common problem first, when the patient goes in to see the doctor, they don't want to be totally honest about what's going on sometimes.
Yeah. It's very crucial for the patient to communicate clearly with their doctor. Make sure that your doctor is aware of all your medical problems, all your allergies, potential prior reactions to medications, and make sure that your doctor is aware of any other subspecialists that you're seeing, whether a cardiologist, a surgeon, and so on. They have to communicate with each other, but do not assume that they are. Be the one who is leading that communication. Be involved in your care.
Yeah, people are oftentimes afraid to admit things to the doctor. Sometimes these things are very, very personal. But I guess the best advice is, if you're a doctor, you can tell me you've heard everything, right?
Absolutely, absolutely. I think that patients recipients of healthcare should be very clear and should be very honest with their doctors. That's the only way to try and prevent medical errors from happening. Otherwise, I can be prescribing a medication that, as you suggested, you may have had a prior reaction to it in the past without my knowledge. So you absolutely have to be clear. You have to be a good communicator with your physician or with any other healthcare provider, your nurse, your therapist, your pharmacist. Absolutely.
And I was trying to suggest this in my initial question, but the embarrassment factor, this prohibits a lot of people from being totally honest. Right?
Yeah.
And I mean, when I said you've seen and heard everything, you've got no embarrassment factor. You look at this clinically, right?
I do, and I guess it's sometimes more difficult for patients to be, sitting across the table from you to be telling you about all of their potential issues. But I think if we are, as a community in the healthcare field, to avoid medical problems or medical errors from happening in the future, there's only one way of doing that, and that is to actively involve the patient into the decision making. And by doing so, we can reduce the risk of medical errors from happening.
What are some common mistakes that you've seen from people who are not totally honest with their situation?
I've had personal experiences where, having asked the patient many times, have you had this medication before, or have you had an allergy to such and such medication before? And they not knowingly probably deny having been exposed to such a medication. I take that in faith and go ahead and prescribe it. They go home, assess the situation and find out that no, in fact, they have been exposed to this medication and they have had an adverse reaction to it. So a couple of times this has happened, and we were able to stop it from incurring further damage to their health. I think it's very crucial for people to be aware of the medications, particularly the medications that they've been exposed to in the past. Write a list of all the medications that you're on and all prior medications that you've had allergies and or adverse reactions to. Share that list with your healthcare providers, whether, again, your primary care or your other subspecialists. I think that's very crucial. Again, I think that the more the patient is involved in their care, the better the outcome is, and that has been proven by research.
Yes, and communication, of course, is a two-way street, and we all know that doctors are incredibly busy people in this day and age, and you have a lot of patients oftentimes, and it is not out of the realm of possibility that they're overlooking certain situations, and this is all the more important for patients to be proactive about their care.
Absolutely, absolutely. You're absolutely right. I think that you as a patient, and we as patients have to be involved, and we have to be an active member of that healthcare team. So in order to get the best care, you have to be open, you have to communicate with your physician, and make sure that they're aware of all the medical issues that you are dealing with.
I had an interesting experience a few years ago when our little boy had to have ear surgery, and just before the surgery, the surgeon handed me a Sharpie or an erasable marker and said, "Which ear is the surgery going to be on?" And I thought it was kind of strange. Well, you should know, you're the doctor. But he wanted me to mark that particular ear.
Yeah.
This is not uncommon nowadays.
It's
right?
not uncommon, absolutely. When it comes to surgery nowadays, most physicians, most surgeons meet with the patient one-on-one. They mark the side of surgery or the site of surgery with a pen in order to avoid operating on the wrong side. So yes, again, meet with your doctor. Ask them questions. If you're apprehensive about something, if you're wondering about an adverse reaction or a potential complication of the surgery, be open with your doctor. You know, again, going back to the medications, adverse reactions to the medications, expect them, know about them, learn about them, so that you can act upon them. Another
crucial factor here is to choose the right hospital. You want to go to a hospital where people are doing the kinds of surgery in great frequency that you're going to be having yourself.
Yeah, absolutely. I mean, I think if my father is to go for, let's say, hip replacement surgery, I would absolutely look for the hospital that has the most track record for that surgery. I mean, the research proves over and over again that the outcomes are better in those hospitals who are acquainted with that type of surgery. So yes, absolutely, cardiac surgery, any type of elective surgery or elective procedure. Not as much with emergency procedures, but definitely for elective procedures, I would seek out the hospitals and or physicians who are more have more experience with those.
A lot of people put doctors on such a pedestal that they are afraid to question at all what the doctor tells them. And people are oftentimes uncomfortable with what the doctor is telling them. Is it okay to leave, to choose another doctor, say, "I'm sorry, I don't trust you," or "I don't like what you're saying, I'm going somewhere else"?
I think that as a patient, you are entitled to have an open line of communication with your doctor. At any point in time, if you feel that that line of communication, or if you're not uncomfortable with that, you are more than entitled to go and seek care elsewhere. So I think that it is an absolutely perfect and fine option if you choose that. Yeah.
And nowadays, with the internet and all the medical information that's available there, it's just so easy for patients to get really up to speed on what's going on out there. So.
Yes, yes. Internet can be good and bad.
Good and bad, yes.
I think that I tell my patients, let me start first so that I can direct you to where to go on the internet, as opposed to being bombarded with all the information.
Which can often frighten people unnecessarily.
More than frequently.
Dr. Assil Saleh, thank you so much for that valuable advice. We appreciate it.
My pleasure. Thank you.